Hi, I'm Chaddington. If you're on Medicare, this is important information. Call the Medicare coverage helpline today. What's up, YouTube? How's it going out there, wherever you are in the big wide world? I'm just sitting here as an American with no health insurance, curious about the Australian healthcare system. Y'all know I love learning about Australia, and it's about time I figured out how the healthcare system works over there, because everyone's always talking about it. They say stuff is free and it's amazing, and everyone in the world should copy the Australian healthcare system. So today we're checking out Australian healthcare system, everything you need to know by Living Simply Australia. Shout out to their channel, link in the description below for that. Don't forget to like and subscribe, and without further ado, let's go.
Hi, welcome back to the channel. Today we're going to be talking about the Australian healthcare system because many people have been asking me they're about to come to Australia and they want to know what health insurance to get, or they don't really know how to access a specialist or a doctor, so we're going to talk about all that today. Let's get started. Okay, the first thing that you need to know is that if you want to go to a doctor here in Australia, you first need to go to a GP. But what is a GP? A GP is a general practitioner or family doctor. This is a doctor that specializes in general medicine. So, for example, if you have a tummy ache, you're going to go first to your GP, to the general practitioner, and they're going to prescribe something for you, whether it is medication or something, to make that tummy ache go away. If your tummy ache gets worse over time and it gets more serious, then you go back to your GP and you ask them for a referral. That is, they're going to refer you to a specialist. For example, in this case, a gastroenterologist, for them to do more medical checks on you. Perhaps you need an x-ray or an endoscopy or something.
Okay, so it works the same way in America, I think. You have to be referred to a specialist. Like, you can't just go see a specialist. Am I right about that? Because I remember hearing once that specialists won't see you unless you've been referred by someone. And I actually don't know if that's true or not. That's just what I've heard, and it sounds like that's the case in Australia too.
So you always go to the GP first, and then if your medical condition gets more serious, you're going to be referred to a specialist. Okay, another thing that you need.
And also on that point, so if you're a specialist, that means you better have good relationships with all the GPs in your area, because you don't want them to refer people to other places, right?
To know is that you're probably going to come across the term Medicare.
Oh.
Medicare, it's basically the Australian health insurance scheme. In other words, it's a public health insurance that Australians get in order to access medical services for...
Interesting. So it's the same term in the US. We have Medicare and Medicaid. And I think Medicare is for like old people. No, Medicare is for poor people, and then Medicaid is for old people. Or it could be reversed, I don't know. And we have MediSave, which is for ugly people. No, I'm just kidding. I'm just kidding, folks. We're all beautiful on the inside. Most of us, at least. But yeah, so they have Medicare in Australia, and that's what they call the public health insurance thing.
Or free or at a discounted price. What does Medicare cover? Public hospital fees. That is, if you need to go to a hospital for an emergency, your hospital fees will be covered by Medicare. Another thing that Medicare covers is out-of-hospital care. For example, if you go to a GP that doesn't have bulk billing, but you have Medicare, you may be able to get a 40% Medicare rebate. You might be asking, what is bulk billing? Okay, bulk billing is when Medicare covers your total medical fee, your total medical costs. There are some GPs that offer bulk billing services, but there are other GPs that don't.
Huh, interesting. So I wonder what determines whether a GP offers that or not. Maybe like the ones that don't, or like a slightly higher quality service that are also more expensive. Because I assume that there are still private hospitals in Australia, right? Like that's where all the rich people go. But yeah, I mean, why wouldn't you choose the bulk billing option where everything's paid for unless you couldn't? It seems like everyone would go for that one.
Okay, now let's go back to the example of the Medicare rebate. Say, for example, that you have a tummy ache, you go to a GP, and this GP doesn't have bulk billing, but you have Medicare, you may be able to get a 40% Medicare rebate. So in this case, if the total consultation fee is $98, your Medicare rebate is $39 and your out-of-pocket expenses are 58 Australian dollars. So those 58 Australian dollars are your out-of-pocket expenses, and you need to learn this term because it's very, very important. This is basically the money that you pay and that it's not covered by Medicare. Another Medicare benefit is subsidized medication. That is, you may get some medicines at a discounted price. Medicare doesn't cover dental care expenses or surgery or stays at private hospitals.
Wait, what? Medicare doesn't cover surgeries or say, okay, I can understand it doesn't cover staying at private hospitals, but surgeries, people have said in the comments of my videos that like they had some operation that was totally covered by the Australian healthcare system. So how could they not cover surgeries? That's like one of the most expensive things you can have done.
Or ambulance services.
Or ambulance services? What? Hold on, that makes no sense because there's no way that Australian citizens that are on public health care are paying 100% of their surgery costs when they get surgeries. That would be impossible because surgeries are really expensive.
Another question that many people ask is, can I get Medicare as a migrant? And the answer is, it depends. If you're on a permanent residency or humanitarian visa, you might get access to Medicare services. Another instance when you can get Medicare benefits is that when you are a citizen of a country that has a reciprocal healthcare agreement with Australia. I'll leave you a link down below with more information on eligible countries and what benefits you may get. Some of these countries are UK, Italy, the Netherlands, and others, but have a look. On the other hand, if you're a temporary visa holder and you're not part of any of these countries, then you're unable to get access to Medicare and you're going to need to get private health insurance. And this is usually a requirement of your visa as well. Here is a table where it shows you all the different visas and the different private health insurance requirements. I'll leave you the link down below.
Can you see a doctor in Australia without health insurance? Because that's definitely a thing people do in America. And in some cases, the cost can actually be cheaper with no insurance. It's like if you have no insurance and you just walk into a hospital in Australia, can you like pay your own way? Or how does that work?
Okay, now let's talk a bit more about private health insurance. Private health insurance is basically like Medicare, but you pay for this. So it's insurance that you pay in case you get injured, you have an accident, or you get sick. It's basically a service that covers some or all of your medical expenses, depending on the type of cover that you get.
I wonder how many people have private health insurance in Australia. I assume that like a lot of the really rich people do, but like what percentage of the population? But I bet those people still have to pay taxes to pay for the Medicare of everyone else. So like they're still kind of paying for Medicare and private insurance on top of that. That would be intense.
How much does health insurance cost? This is going to vary according to the cover that you get. If you're a young, healthy person, your medical needs might be very different to someone who's older or who has a chronic health condition. If you're in the process of coming to Australia and you need to get private health insurance, I'll leave you a link down below to APRA. This is the agency that accredits all private health insurance providers. Make sure that they're registered with this organization. And also I'll leave you a link to compare the different health insurance policies according to your needs. Another good thing is that if you go, for example, to a specific private health insurance, usually in their website they have filters where you're able to specify your needs. If you're single, a couple, or a family, they're going to give you the best options for you. In terms of costs, you can expect to pay around $100 Australian dollars per month for private health insurance. But again, this is going to vary and going to be different from person to person according to your medical needs.
Okay, that's not what I was expecting. That's incredibly low, 100 Australian dollars per month. So that makes me think that it's like that private health insurance is a thing you kind of layer on top of your public health insurance. Because $100 a month, I don't know what you could get for that. Because yeah, at one point in my life, I was on like Obamacare, the public health insurance we have here in the States. That was still like a lot of money. Was it like $1,000 a month or something? I don't know. It was my dad paying for it, not me. So I'd have to ask him. But even when I was employed, it was never $100 a month. It was always like $200-300 a month. So yeah, maybe private health insurance is something you have in addition to public health insurance in Australia.
Another good thing about private health insurance, and that's why many Australians also get private health insurance services on top of their Medicare because they cover stays and treatments both in public and private hospitals. You can also add extras such as dental care or specific surgeries, and they also usually cover ambulance services, which Medicare doesn't.
Yeah, so that's exactly what I was saying. They kind of layer it on top. But do you have to opt into Medicare, or does every Australian citizen just kind of automatically have it? Because like I said, you're going to be paying for it through taxes regardless.
Now, something that you need to take into account is that private health insurance providers usually have a 12-month waiting period for pre-existing conditions. But what is a pre-existing condition? For example, say that before coming to Australia, you had a specific disease or medical condition. This is considered a pre-existing condition because it existed before coming to Australia. And as such, once you come to Australia, you'll have to wait for at least 12 months for your health insurance provider to cover all medical costs related to this pre-existing condition.
Well, I hope it's not serious.
Okay, now many people have been asking what's the difference between private hospitals and public hospitals. A public hospital usually is covered by Medicare, meaning that it's free. Usually you go to the public hospital when you have an emergency or if a doctor referred you to have a specific surgery or an examination. The main difference between public hospitals and private hospitals is that public hospitals usually have a long wait time, whereas private hospitals usually go and you're seen by a doctor right away. Of course, for private hospitals, you have to pay money, you have to pay more, and it's not free. So that's the main difference. And of course,
Well, that's not a shocker. That's what everyone says about public healthcare, is that you get some really long wait times.
Hospitals are owned by a private company and are not public. Okay, what happens if you have an emergency here in Australia? The first thing that you have to do if you have a serious emergency is to call 000. On the other hand, if you have a very strong tummy ache, something of that nature, you go to the emergency room and they're going to see you and make you wait according to how serious the condition is. Another thing that you need to know is that there are community health centers. Community health centers are state-level facilities that provide medical services for people on low incomes. And they charge fees according to how much the client can pay. My understanding is that these community health centers are available for everyone and anyone can access them. But I leave you a link down below if you want to know a bit more about this. You have
So community health centers are something different. It says it's for low-income people. I assumed that the Australian public healthcare system as a whole was for everyone, including low-income people, but it says fees are charged for services according to the client's ability to pay and can be negotiated or waived if payment is difficult. Oh, so I guess that's people who can't pay the out-of-pocket costs even with the public health insurance.
All information you need in this website. I hope this video is a good overview for you on the healthcare system in Australia.
Okay, so I feel like I have a better understanding now, but I still have some questions. Mainly, my biggest question was about the surgeries. It says that Medicare doesn't cover surgeries in Australia. So how do people pay for that? That's question number one. And also, what percentage of people have private health insurance? And also, she didn't go into how much health insurance cost in the taxes situation, because I know taxes are much higher in Australia, or at least that's what I've been told. But yeah, I'm curious what you guys think. All you people who live in Australia, what do you think about the healthcare system? What are the quality of the hospitals like? What is the wait time for public hospitals? But yeah, thanks for watching, everyone. If there are any other videos I should react to, let me know in the comments below, and I will catch you guys next time.